Thank you, Ramon. It's a real pleasure to be here, and especially to talk about the topic of collaborations and partnerships. Now, I'm not a CNBC moderator, but as Ramon said, I am Northwell homegrown. So I'd like to introduce our two esteemed panelists this evening, Dr. Paul Rothman, Dean of the Medical Faculty for Johns Hopkins University School of Medicine, CEO of Johns Hopkins Medicine, and a member of the board for Merck. Thank you, Dr. Rothman. Mr. Paul Clues, the head of the healthcare investing at Qualcomm Ventures and general partner at DRX Capital. And if you wouldn't mind maybe taking a minute or two to talk about your respective roles in your organizations to give us a little bit more insight before we start.
Sure.
Go ahead.
So as she mentioned, I'm the head of global healthcare at Qualcomm Ventures, which is obviously a large telecom, tech company. Sort of wireless tech is kind of the core function, core business. It's a chipset manufacturer, and so I actually sit on the Qualcomm Ventures side of the DRX Capital fund that she mentioned. So I'm a general partner at DRX Capital. DRX Capital is really a 2LP fund that's sole focus is to extract as much strategic value from both the Qualcomm relationship and the Novartis relationship. The Qualcomm relationship is, the investment thesis there is really about strengthening the core in connected health, leveraging the best of breed sort of mHealth and wireless technology that is produced by Qualcomm to introduce 5G medical IoT into the healthcare community across the value chain. And then Novartis's goal is really sort of leveraging their subject matter expertise to also provide sort of use cases, unique, innovative use cases that will be valuable in the digital health ecosystem.
Great. So first of all, I want to thank you for having me here today. I really appreciate the trip up to New York from Baltimore. So my role is I'm the Dean of the Medical Faculty, so that's the School of Medicine at Johns Hopkins, and the CEO of Johns Hopkins Medicine. So Johns Hopkins Medicine is an entity that is both our health system, our School of Medicine, and also several divisions, including an international division, a health insurance division, and a home care division. The whole entity is about $8.6 billion in revenue this year. We have 6 hospitals, 5 in the Mid-Atlantic and 1 in Florida. We have an international division which either runs hospitals or health systems in 18 countries around the world. A large insurance company that has, for 20 years, had a Medicaid product. We have a Medicare product, a Department of Defense product, and a private insurance product, and a home care division. So as CEO, I'm in charge of that entity. So, and I'm also on the board of Merck Group for, as she said, for about 4 years now.
Great. And Dr. Rothman, I'll start with you, if that's okay.
Okay.
Given your current role as Dean and CEO, can you acknowledge some of the strategic or collaborations that have really made an impact and what the driving strategic force behind them might have been?
So thank you for asking. So just to tell you, when I thought about what I'd say today, I looked through our collaborations, and I thought it really comes from mission. So the reason Johns Hopkins Medicine, we think, has been so special for now 129 years is we are a very mission-driven organization. We're there to improve the health of our communities. If you think about how you have to do that, 100 years ago, you could probably do that by yourself in East Baltimore. But given that we have a global community, we really think about it requires collaboration and partnership. And when I looked at them, they really break down into 4 classes of collaborations. The first one, and I really love Kevin's talk today, is all about innovation. How to change the way medicine is practiced, how to have new discoveries that actually change the course of disease. And that's a huge component. Hopkins University is the largest recipient of federal dollars. Over $2 billion of federal research is invested in Hopkins last year. That's one large part of collaborations that requires that, and that's with industry or others. We have a part of collaborations that really follows what we heard today about the value proposition, about how we can bring better value to our patients. The third part has to do with people who want Johns Hopkins to help them with their healthcare needs around the world. And finally, the one that you may not think about is a collaboration to improve our communities. And so given that we do have this mission to improve the health, if you don't try to think through about improving the poverty, improving the food that people eat in your local communities, I think you'll never actually improve their health. So we think of collaborations in all those. I'll give you a couple examples of ones that I'll give you just two quick examples. So for our international and people who want our healthcare, I mean, we run occupational health for Pepsi around the country. We have a lot of different collaborations. The Saudi one's really pretty interesting. So we're now in our 5th year of a joint venture with Saudi Aramco, the oil company, where we run their health system for them. They have 350,000 employees and dependents in the kingdom, and we run their health system for them. That's very interesting, and been really just a great venture together. The other one that I thought you'd be interested in, so this idea about how you can improve your community. And for us, being in Baltimore, we need collaborations to do that. One is great with Under Armour, and actually 26 other companies in the city of Baltimore that, after the unrest, after Freddie Gray's death, decided that we had to try to lift those poor communities up. And so we all agreed to increase our spend in those impoverished communities and to hire people for those impoverished communities. And that looks like last year we would have hired 500 people from those impoverished communities in Baltimore to work at Hopkins. And out of those, 130 were ex-offenders that we have set up a special program for to help reintegrate them into society. So those are just sort of the types of things we do.
Thomas, given your extensive background working with a venture arm in a healthcare system and insurance company, but now transitioning over to large corporation with DRX and Qualcomm, what do you think are the differences with respect to strategic division, direction?
Yeah, absolutely. Yeah, so it's interesting. So I think, I appreciate Qualcomm's initiative here with DRX because I think it was pretty big move in terms of figuring out how to really broaden its reach within digital health, given that Qualcomm is a chipset manufacturer. Yes, 1 in 4 chips, 1 in 4 mobile phones have a Qualcomm chipset in them. That's not really direct impact. That's not really touching the patient's life directly. Qualcomm Life, which is Qualcomm's healthcare division, is a medical IoT connected health company that is in 2,500 providers, but again, somewhat distancing itself from the provider, or from both the provider and the patient, right? So I think in terms of the transition over from investing capital on behalf of a health system, on behalf of a tech company and a pharmaceutical company, it's kind of going a layer deeper into the technology stack, right? So I think it's really I've only been at DRX for 3 months now, but I'm blown away by the technology that's really required to make the whole digital health ecosystem tick. That was something that I think I was just assuming worked, right? I would focus on. In my old role, I would be focusing on the use case pilot, making sure that the data looked good and the patient outcomes were solid. In my new role, it's not that I don't care about the patient outcome. That's obviously why we do what we do. But it's going a little layer deep and evaluating the intellectual property, helping the companies evaluate how to best deploy their intellectual property strategies, because that's an important part of being a successful company in both medtech and digital health now. I'm seeing more of a trend of intellectual property in digital health now, right, with unique use cases. So it's just really rolling up my sleeves and certainly connecting our entrepreneurs with the 2,500 providers that Qualcomm Life has a connection to, but it's also just really digging in on how they're thinking about their 5G deployment, right? Because Qualcomm's one of the first tech companies out there that has 5G on the roadmap here in the near future. So it's really interesting. Again, I still think healthcare is in 3G or 4G at the very best, but it's really cool to be sort of at the forefront of that technological innovation. So.
Great. And just a bolt-on question to that partnership with Novartis and Qualcomm. It's a very interesting partnership, obviously. Do you think that with DRX and I know you're not there very long, but the way that companies like DRX now are going to invest and make investments with, the two different strategic kind of motions that both Qualcomm and Novartis have, is that going to make a difference, or do you see that with what you do?
Yeah, we've sort of gone back and forth. DRX hasn't been around for very long. It's only been around for about 2 years, and certainly digital health investing on the Qualcomm side has been going on for about 5 to 6 years, right? So there's over 30 digital health portfolio companies there. So there's some key learnings from that we bring to the DRX equation. But I think as far as the Venn diagram of intersection between Qualcomm and Novartis, there is a bit of overlap there in terms of common mission to make healthcare a better place. But we don't necessarily have to be within that intersection. So we can, it's 100% collaboration. We're a two-man team. I'm the general partner on the Qualcomm side. My other colleague is a general partner on the Novartis side, and we speak very regularly. So I'm based out of San Diego. He's based out of San Francisco. We sort of take turns doing pipeline meetings. 1 week in San Francisco, 1 week in San Diego. He's been pushing San Diego more frequently, but it's a strong collaboration in terms of us. And then in terms of he's really sort of opened the kimono from the hey, introduce me to some of the business units within Novartis, and I do the same for him. So I think the way we divvy up and how we really effectuate the strategic mission is, we bring, again, Qualcomm's been doing the tech or the software investing for 2 decades now. So I bring that level of expertise from my broader team, right? And then also do very deep tech due diligence with the folks on the Qualcomm side. And again, anytime an IP question comes up, we've got the number one team in the world that can handle an IP licensing question like that. And then in terms of machine learning, AI, edge computing, as that becomes a bigger thing within healthcare, which I think will make healthcare better and make data more fluid. We have experts on the Qualcomm side that are able to do that. So.
Great, thank you. And I think everyone in the room could feel the energy and the excitement around some of the topics that we covered earlier on, especially bioelectronic medicine. Not that I'm biased to Dr. Tracy or Chad, but very exciting advances in medicine recently. And, Dr. Rothman, what is your feeling around, what is the future? What are you most excited about from precision medicine all the way through?
So I think if you had asked what was our largest investment that we actually think will change the way we treat patients, it is precision medicine. And the reason is, from our perspective, there's a confluence of 3 revolutions occurring right now in the world, one of which is a revolution of measurement, another is a revolution of communication, and the third is a revolution in analyzing big data. So the revolution of measurement comes through our ability to, on a single patient with a small specimen, know their genome, their metabolome, their proteome. With the imaging sophistication that we've now developed, understanding how a patient's brain worked, as we saw this morning a little bit, like we've never been before. So we have this revolution of measurement. We have a revolution of communication, both, in our system, we're all Epic Shop. Everyone talks to everyone. Everyone's on the same EMR. But also, our patients can communicate with us via their devices all the time, and we've leveraged that with collaborations with Apple, with an Epi Watch that measures epileptic seizures, and so that sort of communication we have. And finally, we have an evolution in our understanding of big data, and that has come out through many people. In fact, many of our astrophysicists actually began that understanding the stars. So if you think about that, how do you bring that all to bear on patients? And for us, it has to do with seeing if we can understand if there are homogeneous subsets of patients that will react similarly to a therapeutic intervention or have a homogeneous trajectory for their disease. So an example is what we call asthma is probably 10 diseases. They all have bronchial constriction that's reversible, but there's exercise-induced asthma, there's allergic asthma, there's non-allergic asthma, there's smoke-induced asthma. So there's all these different types of asthma, and so they're understanding they're all treated with the same drugs, in any given drug, only 2/3 at best of patients respond to it. So we don't really know diseases. And so the question for us as precision medicine is to try to understand and define those subsets. And so we said, well, we can't do that alone because we're pretty good docs, but in terms of big data, we're not really that sophisticated. I'm sure Qualcomm might be, but we're not. So what we decided to do is we need collaboration. So we brought in 3 other folks that have really helped us do that. One of which is the Applied Physics Lab, which is part of Hopkins. They do a lot of Department of Defense work I can't tell you about, but they're up there looking at bad guys all the time. How about that? There's also, we said we need Epic, because we're an Epic shop, and then we went to Satya at Microsoft and asked him if he could help us. So together we've built a data platform in the cloud that's what's called a data lake. You probably know much more about what that is than I do, but it's an ability to take all that different measurements. So one of the complexities is you have Epic, you have an EMR, how does that interface with genomic data and an MRI, and the proteomic data, and an OCT that measures the neurosickness in the back of the retina. So you actually need a data platform that can put that all together and allow data scientists to look at it and try to find subsets of patients that are similar. And so we've built that platform with the help of Microsoft and our Applied Physics Lab. And we're now using that in precision medicine centers of excellence. We have now 9 of them, and we'll have 50 of them within 5 years, all built around single diseases that people come to Hopkins for. The first 2 are multiple sclerosis and prostate cancer, where we're integrating all that data and asking, can we find subsets that act similarly? And then we have data scientists coming in from some of our tech partners out in California. They said, you docs may think you know subsets. You don't actually know anything. We're going to look at this data separately and see if we can find subsets that the data tell us. And then you tell us if they're important. And so we're sort of interested and on a path that we think is real. And we think that's really going to change how we take care of patients, to your question.
Great. Thank you. I know that there's so much noise out there right now about big data, and it's something that we talk about in Northwell all the time as well. Thomas, from your perspective in healthcare, what is your approach to it, and how do you look at data?
Sure. Yeah, I think we're in a really good place in healthcare where there actually is a data set, right? That we can. I think big data is actually big now. I think that's a word that's been sort of very buzzwordy over the last 10 years, but I think we're finally figuring out how to use structured and unstructured data in an efficient way, or at least are getting better at it. And I think machine learning AI is not an investment thesis for me in and of itself, but it's definitely a means to an end, which is to effectuate things like precision medicine and really sort of provide better quality care to the patient. Deliver pertinent information to a provider to deliver better care. And so, on the board of a company called AliveCore, which has been, around for quite some time. And I think that the machine learning AI curve here over the last, say, 5 years has really leapfrogged the company into getting its FDA breakthrough device designation and effectively being an auto-diagnostic for various heart disease ailments, right? And reading the EKG. It's actually the only device on the market that has FDA breakthrough device designation. That being said, what that does, because the technology stack was so good here, what it does is it gives a provider the confidence that they'll want to use this, right? So physicians are the most the slowest to adopt technology, because the technology it really needs to be perfect. It needs to work. It needs to be efficient, because it's for it to be an extension of themselves. They really need to trust the information. So I think machine learning AI is kind of a foundational thing here, and going back to your original question, which is how I think about big data, you can't develop based on my rudimentary understanding of artificial intelligence and machine learning. You can't develop a good algorithm without a very comprehensive data set, right? Mm-hmm. And so as I evaluate companies in this space, I really look to, I met a company a few weeks ago that told me they had their best of breed machine learning AI algorithm. They didn't have any indexed files, any indexed metadata. They were doing some digital imaging, auto-diagnostics, but they didn't have a referential database. And so that was a red flag to me, right? And so I think the big data is a necessary piece to the puzzle here.
Great, great. So when you think about what's on the horizon, and maybe something some of the people in the audience haven't really thought about, the most exciting or what you think will be the most impactful novel technology that might be out there, is there anything?
Actually, I think machine learning is going to change medicine. I think, and it'll begin with those fields that you can digitalize an image for. So that would be radiology, pathology, and dermatology. Anything you can digitalize an image for, you can machine learn on. And so I think that's the first step you're going to see to really changing and using computers to really assist. Some of the stuff that Google came out recently on diagnosing melanoma was really very impressive. So I think you're going to see, and I think it's not, a lot of physicians are worried that computers are going to replace us, and that might be true in 100 years. I think in the next 20 or 30 years, they're really going to be great tools for us to take much better care of the patients than we ever have. So we actually look forward to embracing the use of machine learning, precision medicine, the IBM Watson type of ways to decrease diagnostic errors by very patterned pathways that get the unneeded variation out of care. I think you're going to see us embrace technology, and I don't disagree with you that we've been slow to embrace it, but that patient-physician relationship is sacred, and I think doctors are very protective of it, and so we're maybe slow to embrace, but I think you'll see real changes of how physicians on a day-to-day basis are leveraging technology to take better care of their patients.
Great, great. And just for the last question, given the time, Sue Siegel mentioned this morning some phenomenal partnerships that are occurring right now in industry. What are some of the partnerships that impact what you work, and some of the ones that are affecting the trends in healthcare?
So I'll just touch on that very briefly. So I think specific partnerships that Novartis is doing are Novartis has been doing therapeutics investing for over 2 decades, and so they have the Novartis Venture Fund. Now, DRX is effectively going to be the digital investment arm of Novartis going forward, and so I'm really, really excited about all the partnerships we're getting involved with in the Valley and in the San Diego area. So it's great to be here and sort of forging that partnership going forward, but more importantly, we've got we've got a lot of networking to do. We're a new fund; it's a new team, but a recent relationship with TechCrunch has given us an ability to judge an incubator panel, which is an accelerator program, and Novartis will also be launching its own accelerator program, which we're really excited about. So it's going to give us. I like to be sort of ahead of the trends. I think when speaking with more mature venture-backed companies, you get a flavor for some spunky technology, but seeing the incubators and working with some of the accelerators out there, you really see some very early stuff, right? And sort of really cutting-edge technology that hopefully we can bring back to our Qualcomm partners and again connect the dots there around 5G and some of the best-of-breed medical IoT that we're working on.
Great.
I would just add, I think that's all true. I would just add the partnerships on the payer and delivery side we're seeing increasingly, and I don't know how in the future if you're not both a payer and a deliverer of care, you're going to be able to survive. So how those partnerships might play out over time will be complex, but I really think the partnerships between the payer and delivery side is where we'll be at in not too long a future.
Great. Thank you both for your time today. Very interesting.